what is GERD?
It stands for gastroesophageal reflux disease, and people will, of course, call it acid reflux. And then, of course, there's another version of it called LPR, which is, I think, laryngopharyngeal reflux. Both of them are conditions in which you either have too much or too little stomach acid, but typically allopathic doctors will diagnose it as too much stomach acid. But in some way, you have acid coming back up your esophagus and causing either, that feeling of warmth, or it can be, an acid feeling, an actual heartburn feeling, or it could present like the LPR is more of a silent reflux, which is what I used to have, which presented more with a constant cough for me. And for some people can then also have sinus implications and can cause, I used to wake up and have dark phlegm because clearly things were coming up my throat during the night. So it was that kind of a symptomology.
Well, and I think that's a really good point. So if somebody just has sinus issues, and they've done the traditional allergy approach, food elimination, etc., and it's kind of like, well, what is it? So it could actually be associated with a little bit of reflux coming back up here, creating some sinus issues. I think that that's surprising to most people. So I think that's an awesome point that you made,
Right.
that people don't really seem to know about as much, right? So that's pretty neat. So I guess you talked about it being too little or too much stomach acid. So the debate wears on, right? So kind of, so maybe let's break that down a little bit. Is it too little? Is it too much? Or is it kind of a mix of both?
Well, I think it can go both ways. So I think a lot of GERD behind it is H. pylori or Helicobacter pylori, which is a bacteria that can cause ulcers and can cause stomach cancer if you have the virulence factors. So there's a test like the GI map, which is a stool test that will actually show the virulence factors. And so you may have H. pylori, but none of those factors, which means that your H. pylori is more benign. But that being said, I have yet to find a client who had H. pylori who wasn't suffering some symptoms. Of course, I don't have clients who aren't suffering from symptoms and who didn't benefit from education around how to eradicate it. So when you have H. pylori, one of the first things that happens is you actually end up having less stomach acid. And that's called hypochlorhydria. And so at the beginning, it will reduce your stomach acid, but then over time, it can increase your stomach acid. So you may have some combo both, and the symptoms may be similar. Because when the pH isn't correct in your stomach, that can open up the lower esophageal sphincter and acid can get up. So it can kind of go both ways.